Sergio, Dr. V. Good morning. You are a pediatrician and a pediatric cardiologist.
Absolutely.
And you studied at Johns Hopkins for medical school?
Yes.
Hospital. While you were having your education as a doctor, did you study the effects? Did you study the physical effects that smoke could have on one's body?
Of course.
Can you tell me some of those effects?
Well, first of all,
was it fairly new?
Smoking is harmful to your health in many, many ways.
Okay.
Number one, because the tar will cause changes in your cells in the lungs and will cause also emphysema, which is an increase of the fibrous level. Cells may end up giving you lungs, which is usually fatal, and you get it very early. Now you have to know that the tobacco has more than 50 poisonous compounds. It's not just the tar or the nicotine. And that's why when people smoke, all the organs is affected. First of all, the lungs, but also the heart and the cardiovascular system. What happens that the cardiovascular system on the certain arteries will cause micro lesions in the intima of the arteries. And these micro lesions eventually will build up plaques. And also deficiency in those two arteries. That is important later on to go and point it out. Now, when you smoke, you also inhale all the substances that are poisonous, and it causes, for example, the bladder cancer is increased because of the tar and this obnoxious substance being collected in the bladder. So the bladder cancer is increased many folds. Just as well, breast cancer, colon cancer, and lung cancer, as we said before. That is about cancer, but also will cause other problems. The insufficiency of the coronaries will lead to a heart attack, usually at early age, like early 40s or 50s. And the damage in the carotid arteries will lead to have stroke. Particularly women that smoke and use estrogens for contraception, the contraceptive pills. At one time, strokes were something which is cerebrovascular accidents, was pretty much a male condition. Nowadays, because of the smoking on the woman and also the use of contraception, the woman has more strokes than men, and unfortunately at a very young age, in the 20s and 30s, which can leave them pretty much crippled.
So does contraception and pills and smoking, do they not mix?
It's no mix at all.
Okay.
Like driving and drinking.
Okay.
It's very little. And the other thing is that the problem with the smoking that they start usually when they are at early age.
Okay, so why do people smoke?
Yeah, well, first of all, when you're young, it's peer pressure. And people, teenagers want to be different, but usually they want to be different to the others, but not to teenagers. So if the teenagers smoke, they like to smoke too. And I think right now more girls smoke than boys. I think it's something like 80% of the girls and 27% of the men, which was reversed too. And sometimes there are psychological reasons why they smoke. And I can tell you one important case that I know firsthand is a man that brought a child to me, and the child has asthma, and I said, you know, you shouldn't smoke, your child has asthma, and you should quit. He said, I tried many times, I could never quit smoking. And I asked, you know, when do you start smoking? And he says, I started at the age of 23. And I said, well, that's rather late. Usually people start when they're teenagers. How does it happen that you smoke? He said, well, what happened in Michigan, my friend was driving a car in winter and scared, and they crashed the car. So the paramedic came, and they asked each other, you know, how the driver is doing. The guy said, oh, the driver is okay, and what about the passenger? Well, the passenger, I think, is dead. So, but he heard that. And then somebody see the little steam coming from the mouth and say, no, he's not dead. There is a steam coming from his mouth. So they resuscitate him, or whichever was, brought to the emergency room. And then later on, they met each other again. And the driver was a smoker. So he decided he's going to smoke too. And that was one of the clues they gave me, because when I asked him, you should stop smoking. He said, oh no, I cannot stop smoking, because if I stop, and he broke his hands on the neck, he said, I'm going to die. And I said, no, you're going to die because you smoke, not because you stopped smoking. So then I asked him again, and he said, were you sick when you were a kid? Do you have asthma? Because you said, oh yeah, I have asthma. And at that time, they used to put in a tent with oxygen and steam. And that's also, he thought the steam made him, you know, better. So my interpretation at that time, he said, you know, why you smoke? Because you think that if you smoke does not come out of your mouth, people will know you're alive. And he said, really? I said, yeah, I think so. So like any other type of neurosis meaning when you have an action that really does not make sense, for example smoking or biting your fingernails or one of those things, if you find the cause, sometimes you cure them. This guy came later on to my office and said, you know, since you told me that, I don't need to smoke anymore. So that is important. Sometimes the reason is psychological. It's not really that they are hooked up psychologically to the tobacco, but there is some sort of relationship like this.
Okay. Now, can a former smoker have the same lungs and respiratory system as they did before they started smoking?
Well, the lungs usually, if you get it, you know, after a few years of smoking, before it gets fibroelastic tissue that cause emphysema, that can be, in a way, be back in time, because if you don't smoke for 10, after you stop smoking for 10 years, the chances to get lung cancer in between the smokers and non-smokers is the same. However, damage in the cardiovascular system is not reversible, and that's a cross that you have to carry all your life. Okay,
you are a cardiologist. How does the smoke affect your cardiovascular system?
Well, as I said before, the nicotine and all the poison cause micro lesions in the coronaries and also in the carotids and also in the pineal gland, in the pineal blood vessel. That is very important for teenagers to know, the male teenager, that the majority of people over 40 years old that have erectile dysfunction is due to smoking. And when you smoke, you cause micro lesions into your pineal arteries, and then plaque forms, and then that's where you have insufficiency in your pineal artery artery, and you have problems with the erection.
Okay.
So that is important to know, because most of my patients, they don't care if they get a stroke or they get a heart attack, but they said, oh, that may happen, yes, it may happen to you if you smoke. So they quit the smoking, because that, for
That's a good
men,
point.
is really bad.
Yes. Okay. Now, are both sexes affected equally by smoking?
No, as I said, the female, for example, is more prone to get lung cancer than males if they just smoke, and is more prone to get strokes if you smoke and then they take contraceptive pills. And also the female will have, for example, more problems with the breast cancer, which men, also can have breast cancer, but usually 99% of the breast cancer are in females. So in that respect, affect more on the woman. The men, they can get more or equal amount of problems with colon cancer, stomach cancer, bladder cancer, and other cancer as well.
Okay. And secondhand smoke is a big problem in the world, and there are many laws that are preventing a lot of secondhand smoke. How does it affect somebody's body?
Secondhand smoker was proven, for example, in California, the bartenders that work in an environment with high smoke, even if they don't smoke, they have 36% more chance to get cancer of the breast. And so other cancers, uterine cancers, and things that don't seem to be related to other than just the smoke. And so in that respect, does it...
They're affected equally?
Yeah, equally but different organs, I would say.
Okay. Anything else? I think that's it.
No.
What else? Tell me more.
Well, I think the message is that it's very easy to start smoking.
Yes.
Usually people don't like to smoke. It's something that was acquired from the Indians, American Indians, that did have the tobacco. Tobacco did not exist in the world until the colonizer came to America and then took this Indian custom. And so when you want to stop smoking, there was a lot of different ways to try.
Yes.
One is to take medicine like Chantix. That works about 45% of the time.
I just saw a commercial for Chantix today.
It helps. And also, you have to have motivation to quit.
Yes.
Like a child, or your child is sick and have asthma. Then you have more motivation than if you don't have children or people that is going to be affected as a second-hand smoker. But sometime it was proposed, and I know that worked many times, maybe 20% of the times, is they were proposed